A lot of people feel that melanoma is just dangerous skin cancer of older people. So we're here to dispel that.
My daughter, Claire Wagenhurst, was diagnosed in 2011 when she was just 14 years old with what turned out to be a stage 3A melanoma. What was odd about it, two factors. First off, it happened so fast. She was screened 6 months earlier and she was perfectly fine.
Melanoma caught early is almost 100% curable. This is Inside Out Dermatology with Dr. Julie Kenner, where we explore science, skin, and well-being. I'm Dr. Julie Kenner, the host of this, and our podcast is all about exploring the interaction between skin, hair, and nails sometimes, and our internal well-being. So today we are blessed to have Marianne Banister as our special guest. She is joining us from Colorado, and she has an important story to tell. This is a story that has profound impact on all of us within our communities, sunny or not. And this is the story of her daughter, Claire, who had a very early melanoma. She was, well, I'll let Marianne tell the story. But unfortunately, a lot of people feel that melanoma is just a skin cancer, a dangerous skin cancer of older people. So we're here to dispel that today.
Well, okay, well, just cut me off when I need to quit talking.
The mic is all yours.
I am obviously passionate about it, and it's from my heart. And thank you so much for asking me to be a part of this today and all your good works toward that. Our story is this. My daughter, Claire Wagenhurst, was diagnosed in 2011 when she was just 14 years old with what turned out to be a stage 3A melanoma. It was on her ankle bone. And what was odd about it, two factors. First off, it happened so fast. She was screened 6 months earlier and she was perfectly fine. It was on her ankle bones. It required a plastic surgeon to take it off because that skin is so thin. And we knew we'd be very delicate. We'd probably have to do a graft. And we kept getting put off and put off. Oh, kids don't get melanoma. What are you talking? It must be a Spitzneva. Oh, it's rubbing up against her cleats. She's in summer sports. Oh, this, that. We'll get to her when we can. That was in June. We finally got it taken off beginning of September. And then it took them a full month in pathology at Johns Hopkins. We're primarily a Maryland family. That's where we were. Thankfully, wonderful hub of medicine. But yet it took the pathologists a month to come back with a final decision because they couldn't believe what they were seing. And they just kept running it.
So, Marilyn, can you explain to our audience what stage 3A means? I know what that means.
Okay. So first off, what we found out later, we were just gobsmacked and blindsided. So I've learned tons in the meantime. That's what our organization's about. But young people do not get squamous cell or basal cell. That's due to, obviously, the sun exposure, and your genetics play a code as well. Young people only get melanoma. And that's the type of skin cancer that goes internal and spreads through the body, through the lymph nodes, the bloodstream, to other organs. And so the idea is the earlier you catch any cancer, we know is best. But melanoma is staged from stage 1, and then it goes ABC to stage 2, ABC, 3, the same, and up to stage 4. And stage 4, when Claire was diagnosed, you only had a 20% chance of survival of a year. So we're at a stage 3, just barely a 3. That's why they called it an A, which meaning they thought there was a chance it had spread, but they weren't sure. So thankfully at that point, it had not spread elsewhere into her body, but we were just going crazy thinking, how could this happen? She's 14. She wears sunscreen all the time. She's fair-skinned, fair-haired, no history of this in the family. She's never been to a tanning booth because I drive her everywhere and I wouldn't allow it anyway. Side conversation about that to come. And so we were just dumbstruck. Well, coincidentally, the second component to this, which I'm a journalist by trade, and so I just jumped into, what I knew, medical journals, and used to do medical reporting. And I found that there was a correlation between her body going through hormonal changes related to puberty. In her case, it was very specific. She was the perfect little storm. She developed hypothyroid, which can happen, relatively common to adolescents as they go through puberty. Our pediatrician was aware of this. He did pre-screening a year earlier, just routinely. He found she was headed that direction. And when we saw the mole had started to change differently than it was 6 months earlier at the dermatologist, we were at our pediatrician. And he had just, it was her wellness check for school for the next year. And he came through with her blood workup and said, whoa, she's fully clinically hypothyroid now. And I'm like, okay. And we weren't putting two and two together. So when I started researching, I found a study out of MD Anderson in 2008, Dr. Julie Ellerhorst, who found, and I'm going to try to make it as simple as possible, if you have a mole and it has a receptor, meaning it feeds, right, a receptor to TSH hormone, which is what you have too much of if you're hypothyroid, then that combination can work as food and create melanocytes in the mole and develop melanoma. So they took Claire's mole of origin that we took off, and she came back and said she has an extremely high receptor. Her TSH, her hypothyroid, caused her melanoma. So she was dubbed an adolescent melanoma case. Now, does that mean every kid going through puberty is going to develop melanoma? Absolutely not. Claire had obviously somewhere a genetic component. Obviously, this happened to her. But my point in sharing that is if you have a teenager who's about 13 or 14, they're kind of lethargic. On the East Coast, the reason they check this, you have Lyme's disease, you have these other, do you have, just what's going on with your kid? Why are they homesick all the time? And
Right.
so he just routinely does this check so he kind of knows what's coming on. So
Right.
if you see flags that, might head towards hypothyroid, is your child cold all the time? Are they're sluggish? Any of it, just go get them checked. And that doesn't mean they're going to get melanoma, but that perhaps means keep an eye out for things. And if anything changes right away, get them in to the dermatologist.
Right.
So that was her diagnosis.
Marianne, let me make a comment on that, if I may.
Mhm.
There's a lot of new evidence coming out now about how genes themselves don't dictate our phenotype or our expression of disease. It
Right.
really is the epigenetics. So yes, hormones can play a role. Absolutely. The epigenetics is the environment that gene finds itself in.
Right.
But there are a lot of other things that can alter the epigenetic environment. And if you happen to have that gene, it will become expressed.
And
So
that's the point. And so
yes,
far, we don't know what we've got going on inside any of us, right?
right.
And you don't know how it will respond. There's young people who are diagnosed at a greater, like a young woman who was at 18 months. Her name's Marianne. And she's now 22, and she had a higher level of melanoma diagnosed at 18 months, and she's thriving and doing fine.
Right.
Yes, it depends on the individual.
Yeah.
When we were diagnosed in 2011, we thought we beat it, and we did for a long time until melanoma has a habit of coming back.
Mhm.
And it spread to her brain through leptomeningeal disease, where it's the cancer cells floating in the fluid around the brain, not a tumor. And ultimately, that's what cost us, right, her fall of her senior year.
But I wanted to say, too, that I have diagnosed people with, there was a case in Hawaii on the Big Island, on the Kona side, where it's very, very sunny, and children kind of learn to surf before they can learn to walk practically.
Yeah.
And I distinctly remember one young woman who was 19 years old, and I diagnosed not only melanoma on her, but also a basal cell. So you can get basal cell and squamous cell early if you get enough hits. So a lot of the cancer research of old was kind of this two-hit theory, but I think there's a lot more complexity to that. But it still is, what does that gene see, and how many offenders will it take before in the environment before it will then express itself? And as melanoma can occur in totally non-sun exposed areas, roof of the
Exactly.
mouth, genital area. And so it isn't something that everybody should be kind of just saying, "Oh, well, I wear my sunscreen, I'm safe."
That
You're very
that is
correct.
our point
Yeah,
because Claire got screened. She wore sunscreen and still it
yeah,
happened.
yeah,
So part of our journey, it'll be 12 years in October since we
yeah.
lost her. And our whole point was we, as an overly informed, educated journalist who saw all sorts of things to the point my girls would go, "Mom, you're so paranoid." And I'm like, "Yeah, well, it could happen, right?" I just did a story on that the other day.
Right,
It can happen.
right.
And we were very, very cautious. So
Yeah.
we got blindsided, and the medical community was so ill-informed and uninformed about it in this age. For instance, and this is where I get my mama bear up, but obviously melanoma cases are from birth, let's say to 100. The majority will be
Mhm.
Anglo men over 50. Okay, we got that. But young people don't get cancer as often. So and Skin Cancer Foundation has these statistics. When you bring it in to those who, and again, it's extremely rare in pediatrics, extremely
Mhm.
rare. But if you say from 13 to 29, it's the number 2 cancer in adolescents, the
Mhm.
number 1 cancer in young adults, and the number 1 cause of cancer death in young women 25 to 30. And
Right.
along with you don't know what can trigger it, it can happen in pregnancy. We were
Mhm.
told, Claire, assuming she was going to survive, which we expected, she should never go through a pregnancy. That would prompt it. We've interviewed and had a friend of our foundation, a Maryland mom who has gone through 2 pregnancies and almost lost her life both times
Mhm.
because it occurred and then reoccurred
Mhm.
during each of her pregnancies. She's fine, and the kids are great. But we started, and they're looking at testosterone surges in young men and all of this. So, what our information and what we try to educate, and we want to empower young people because we deal with
Mhm.
the young kids at a certain age who are
Mhm.
trying to go, Mom, I don't need your help. Get away. I'm on my own. And they're gone all day. And then they're off to college, and you don't really have control. So, we want them to understand why they're at a different risk than most. Like, for instance, it's more aggressive in young people. Johns Hopkins did a study on that in 2016, more aggressive and more invasive. So you have less time to sit around and think if you want to take that off. We
Mhm.
talk about how to wear sunscreen the right way. Don't use the spray. It just blows off. Which products are best, how often to, wear it. Ocular melanoma, that you should wear sunscreen when you're flying or driving down the beach. Make sure you
Mhm.
have, something on your arms or at least sunscreen going down. We talk about UPF 50 a lot. And HeliaCare, that wonderful herbal supplement that helps the body kind of like a double whammy protect.
Mhm.
And so what we try to do is give them all these tools and say it's nothing to be scared about. Protect yourself, but then the most important thing is to get screened. And we can no longer provide them, but for 8 years we provided free skin screenings in the Mid-Atlantic area and down through South Carolina. And we had screened over 1,500 young people and found 16% needed to have biopsy.
Mhm.
And a good number of those were early stage melanomas. So, talking about the stages, if it's stage 1, just for your audience, if it's a stage 1 or even a stage 2,
Right.
great for you. You've nailed it. Just
Mhm.
keep an eye on that thing and the rest
Right.
of your skin. But getting in early is so essential. And our whole point was if the medical community was informed, if they would have seen her right away when we wanted to see, and our pediatrician was recommending it
Mhm.
as well. If
Mhm.
we got it when it was first very early, like maybe a stage 1 or a 2, she'd probably still be here. But
Right.
because the medical community was ill informed,
Mhm.
uh, we lost her. And
Right.
things have changed a lot, and we just don't want other families going through what we have. So we
Yeah.
just try to offer a lot of information,
Well,
podcast, on
yeah.
our website, in the work we do, just to get it
Yeah.
out.
Well, thank you for sharing that. I know it's beyond the pale to think about losing your child. I mean, that is not what we as parents
Yeah.
ever think, that our children will die before us. So I thank you for sharing such a personal an important story for others to be aware of. And I 100% agree with you that melanoma caught early, it doesn't mean it's not cut out. It still is cut out, but melanoma caught early is almost 100% curable.
Absolutely.
And that is the take home message is that we need to inform people better about how to do that, doctors included. And I think some of the exciting areas in medicine now are technologies that can help sort of democratize the assessment, because there are human errors in dermatologists are still considered the gold standard for doing a skin check, but a lot of primary care, especially for kids, are doing this skin screening, and they may or may not be doing a thorough skin screen. They may be looking at their back or chest and face and arms, but ignore the bottom, especially the bottom has become an area for melanoma in girls in particular that go into tanning booths. So, they may just not be looking.
It permeates everything. And that's one thing that we always urge people. Now, mind you, I'm originally from Eastern Kansas. Rural areas like that do not have access to a dermatologist such as you, right?
Exactly.
So there's new technologies that are just becoming available. Like DermTech has one, where if they're trained right, but what it doesn't diagnose, it just says this needs to be looked at more closer.
And it's just looking at the gene. It's not looking at the gene, the collection of genes. So it has.
I have had so many parents who have called me heartbroken, saying, I went to my pediatrician and they said it was fine. And now I find out it's not. And their kid is really in a critical situation with this. The parent did the right thing. And it's kind of like, they're not trained to do that. They've got all the other issues of a child's health they're dealing with.
Yes, exactly.
And I always say, would you go take your child to your dentist because they had a head cold or for a strep check? You're not. There's dermatologists should be on the routine. And that's what our screenings were about, because we actually kind of put ourselves out of business, because we opened the door on a special day to allow young people access, because they'd be at the end of the line trying to get in. It could be a 3 to 4 month wait, right? Just to get in as a new patient. And all of a sudden, then they're a patient. And then, they could then schedule their next screening annually. And so through that access, we weren't really needed much anymore. And it just was so wonderful to see that new connection getting started. Do you find it, I get frustrated about this, and I'm sure you do, where if people come in and they'll call me after screening and they'll go, oh, they did a biopsy, but it wasn't anything. I was like, well, can I ask, what was it? With HIPAA, I have to ask, you're not going to tell me. And they'll go, well, it was just a stage 1 or stage 2, or even an in situ, which means it's very, very, very early, right? And I was like, are you kidding me? That's a win. And they're like, no, but it wasn't a melanoma. I said, no, it wasn't a problematic melanoma yet. It's the same as if you're an adult of a certain age, which I am. If you have to go get that colonoscopy, if they go in and they're sedating you and they're putting you under, and you have to go through all that miserable prep, and then they say like, oh, we found a polyp, and you're like, phew, dodge that bullet. How is that different than going in for a 10-minute screening in a gown? You're not sedated. And if they find something and it's a stage 1, it hasn't gotten nasty yet, or even precancerous or in situ, but you nailed it early. And I always try to explain that as the equal.
Exactly. Well, I always tell my patients the stage 1 is a melanoma. Even in situ is a melanoma. We just tell them, great, we caught it early, and you need to be followed more frequently, because if a person has one melanoma, their chances of getting a second are 12-fold higher. And I have treated many patients with multiple melanomas in their lifetime. And so we keep them on a tight leash, so to speak. But one of the things that I'm trying to do with youth, so all of the things that you're doing are just spectacular. And I think that this conversation needs to be, expanded many thousands of fold so that we have ears. But I think, the youngsters of today are going, all of them, boys and girls, girls more, are going to the beauty counters and things like that, and they are getting products. And it might be interesting for your foundation to talk to Sephora's or some other places like that, because I think it's very powerful to meet the kids where they're going.
Right.
That's one thing. And then the second comment that I wanted to make is just sort of this, what I talked a little bit about earlier is the epigenetics and how important that is. And we didn't give that enough attention, perhaps, a while back, because we just thought the genes were everything. I mean, that's really where we thought everything was. But it turns out really that environment is so critical, and absolutely talking to politicians and getting those tanning beds banned forever. Just like, cigarettes in young people should be banned in every country, in every instance. But also looking at different ways to alter the epigenetics in a positive way. And so we at our clinic have spent really more than probably it's been about 2 decades of my career working on developing retinoids for children. Retinoids are the vitamin A class that skin uses to do all good things positive. And I call it the great skin normalizer. And it is well known to be anti-cancer. And it is well known to also affect acne in a positive way. So these are things that could be promoted to children. We've created a version of a retinoid that is not retinol or tretinoin. So it's not the irritating forms, not the active forms, but it is a precursor for both of those. And so what happens is that goes into the skin and is turned into the actives on the underside so that it doesn't cause the irritation and drop off that you get with a lot of these irritating forms, but that it still can do the same good things. So the idea is, can we, because as you know, rates of melanoma have continued to rise excessively. I mean, back in 1935, 1 in 1,500 people got a melanoma. Now it's 1 in 40. And yet we've been telling our children for decades and ourselves to wear sunscreen. And more recently, we've been saying wear broad spectrum sunscreen for every day. And yet, despite that, we still get higher and higher rates. Is it all just earlier diagnosis? Or is there something else going on? Are there other factors? And so if we can actually encourage the skin to recover itself from whatever insult has hit it, while we are protecting as best as possible, can we then have an impact on making a difference on the rates of melanoma? And in particular, in the vulnerable groups that experience the more aggressive examples and the more fast-paced examples that we might not be able to get ahead of, such as with Claire.
Well, so, and it is, there's that, it's just now what you're talking about is where when we first started out, Claire would go crazy on Melanoma Monday. All anybody talked about on the news or anywhere else, wear sunscreen. She's like, Mom, that has nothing to do with, I was like, I know, honey, I know.
Right.
It's come, I cannot tell you the battle we had when we first started this in 2014, when our organization first started, was to try to get people to look at other causes other than the sun. They thought I was this crazy grieving woman who was trying, she must have not put sunscreen on her daughter. She must have snuck off to a tanning salon. And it's like, no, and no.
Right.
And being, that I knew how to, share facts and I had a reputation for that. It did help. It did help tremendously. Things we ran across as well, just, for instance, Claire couldn't get on the trial, what is now first line of defense, Keytruda and Opdivo, because she wasn't 18. She was 16, she was 17, and she got approval just a few months before it went to her brain, when then it was too late. But if she'd been able to get access to those trials, well, now partly because of our work, and I'm very proud of it, is a lot of these trials are now lowered to the age of 12, which is a huge difference, because a 12-year-old's much closer to an adult
Right.
than a 4-year-old. It's not going to be
Right.
the same thing. So, okay.
Right.
Thank you. That's a great start. But then, with the tanning and I always try to explain to these young people, and we have a video with a young woman. Her family is loaned to us. She's passed away years ago now. But she talked about the addictive nature
Mm-hmm.
of these tanning booths. And young
Right.
people don't realize how they're getting pulled in, how it
Right.
kicks in the endorphins. And you think, oh, I'm just going
Right.
to do one more time, one more time. And then when I
Mm-hmm.
explain to them, and correct me if I'm wrong, but I've been told that you get the color so quickly because it goes so deep into the epidermis, and that creates the color right away. But that's where the damage is. And the statistics we've used that we were given is that one time in a tanning booth, increase your risk by 75%. And we use that particularly with young college students, young
Uh-huh.
women, and their mouths just drop.
Right.
And, they don't realize it doesn't give you a base tan. It doesn't make you healthy. There's not one good thing about it. And it took a long time to
Right.
get it blocked for minors in a number of states. And now the FDA's just flipped that back
Right.
with no reason.
Well, the other thing that UVA does is it does have this long sine wave that goes way deep in the skin, but it also prematurely ages the skin. And
Mhm.
so sometimes kind of going through the angle saying, well, this is going to make
Ego.
your skin wrinkly and saggy. Do you want that? Yeah. So yeah, I think there's a big opportunity to when stories like yours get out so again, thank you for doing your podcast. Just tying this into sort of the whole spectrum of how this can impact the lives of kids and and working with some of the industry, be it the tanning booths, be it the makeup centers and skincare sort of shops that are, they're just out there to sell pretty products for the skin. Maybe, kind of having awareness put into that, maybe that will filter through. We are trying to do programs for kids in this clinic, getting them in and just talking about skin in general. They often have acne issues at this age, but I always talk to them about skin cancer and things like that as well. But I think it's just, and even filtering into the school systems through, a lot of schools have sex ed, but I think they need to have talk about sun and this would be areas for groups like yours, groups like the AAD, but also sort of the public to really put their arms around, because it is something that can be seen in the majority of cases, and it is something, if we catch it early, we should stop. And
Absolutely. And what we try to add is, like, we've had a whole program with USA Lacrosse, where we go to tournaments out west. We've been in Santa Barbara a couple times, and Colorado, and then on the East Coast primarily. But athletes are at special risk. They're in the sun so much.
yeah,
The average NCAA athlete in college will spend 1,200 hours a year in the sun. Well, that's by the time they get there. They're
yeah,
playing from the time they're 5 on, at least.
right.
And things like taking a leave and Advil or any of that thing can make your skin more sun sensitive.
Yeah.
So yeah, you have a
certain
month to
antibiotics.
take care of it, but know that.
Yeah.
And know that tent you're sitting under, is it UPF 50 tent? Because if not, it's only blocking 6% of the sun and you're still baking under that.
Well,
we
and then of course UVA is reflective and it bounces up off the ground and hits you, even if you've got a hat or a sunshade.
Yeah, on
Well,
the turf and all of that
yeah,
stuff. And where people, that's where we talk a lot about UPF, because kids will say, oh, I wore a baseball cap. I'm like,
yeah,
with the holes in it? Yeah, no, what's that made out of it?
And what about your ears? And
Yeah,
well,
yeah.
cancer as a whole is more common than all other cancers combined.
Yeah.
And I think this is really best public health. So we're at the close of our time. And what I would like to encourage my listeners and Marianne's listeners is to pass this on to friends who might be interested, mothers, fathers, uncles, aunties, grandparents. because I think, getting the word out with your story is going to be saving lives every day. And
Yeah.
so,
That's
what
what
you're
we're all
doing
about. We
is
just want to
profound.
raise the flag, send out the warning, shout from the
Yeah.
mountaintop. You can protect your kids, you can protect
Yeah.
yourself. It's not
Yeah.
hard.
Yeah.
Thank you for the
Oh,
time.
Marianne, thank you so much.
Okay.
Have a wonderful rest of your
You
day.
as well. Bye bye.
Thank you. Bye.